Hello, good afternoon everyone, and welcome to the Royal College of Physicians of Edinburgh. It's so exciting to see so many of you here in person and also to the others joining us online. My name is Heather and I'm a member of the Trainees and Members Committee of the College, and we're involved in representing doctors in training both within this college and beyond, and also in developing educational opportunities and resources. So in terms of my journey, I studied at the University of Edinburgh and completed foundation training here. I then popped over to New Zealand for a few years to live and work, and then returned home to do internal medicine training, so physician training. And with us today, we have representatives of 4 medical schools, and it's exciting to hear them speak shortly. And many of you will hopefully attend these schools and become doctors of the future. I applied to some of them, but only got into one. And I think everyone's journey of getting into medical school and of becoming a doctor is different. And there's such an exciting breadth of opportunities as you go through your journey. And I think there's an interesting and important niche to be found for everyone. And each university and city will also have different extracurricular opportunities, and I'd encourage you to consider them in your journey. That's important as a medical student and beyond. I did salsa dancing and triathlon at university, and that's been a great part of my university life and my life as a doctor. So we're now going to hear from each university, and we're starting with Vasiliki from the University of Edinburgh. So each speaker will come up, and at the end we'll have an opportunity for questions from the audience and also online on Slido. So you can scan the QR code and submit your questions as we go along, and then we'll go through them at the end. So join me in welcoming Vasiliki.
Thank you, Heather, and it's great to be back again. My name is Vasiliki, and I'm the Admissions and Recruitment Manager for the College of Medicine and Veterinary Medicine, the Edinburgh Medical School, and it's great to see so many young people that they're thinking about a career in medicine. I will start my presentation with just a short mention that this year we are really excited because we're celebrating the 300th anniversary of Edinburgh Medical School. We have been definitely training doctors for a very long time, and it's not like studying any other course, because when you graduate, you do so as a qualified medical practitioner with all the knowledge and competence needed to be trusted to take care of the lives and well-being of others. This is just a short reference of the timeline of activities we're going to be doing this year, and there will be opportunities for everyone to get involved, and we plan to live stream some of these events to our global community. If you want to find out more about these activities, do head to our website or scan the QR code, and then just put yourself in the communication list to find out more. Now, who are we looking for? So we're looking for someone that has shown an interest and motivation to study medicine, who has explored either by voluntary or paid work or any other experiences of what it means to be a doctor, has a breadth of relevant experiences and can think about what they have learned from them. They prize teamwork and communication skills, components that are very important in any specialty that you're going to pursue, and has a high level of academic attainment and likes to think and problem solve. Medicine is a challenging career, and it has to do with lifelong learning. Also, even though we do not assess them, we do take into account any health issues or conditions you let us know, so that we can provide any reasonable adjustments to support you with your journey. Now, this is just a brief overview of our entry requirements, but you can find more details in our degree finder, and I'm happy to chat to you once I finish my presentation. But in a nutshell, the important thing is that we do not accept any receipts, so all grades must be done in the first attempt. Now, we do give additional consideration to specific group of applicants, and we call them flag and plus flag applicants. And these are those applicants who haven't had the same chance to show their academic potential at school or at college, because we believe that everyone deserves an equal opportunity to study in Edinburgh, and we'll take into account certain context in their application. And for flag applicants, we do give additional consideration in academic score, but they have to meet our cutoff for the UCAT. And meet also our standard entry requirements, but for plus flag applicants who just need to meet our minimum entry requirements, they do not need to meet our cutoff score for UCAT, but we give them additional consideration in regards to academic score in terms of their UCATs, and we guarantee them an invitation to one of our assessment days. Also, any applicant who is in receipt of the UCAT bursary, they get the same concessions as plus flag applicants, and any Scottish domiciled applicants who are in SIMD 40 postcode are, although they're required to meet our cutoff score, we do give them a 10% uplift in their original UCAT score. These are the minimum academic requirements for plus flags. Again, we do not accept any receipts, but as you can tell, there is just a slight reduction in our entry requirements for this specific group of applicants. Now, the UCAT test is a very important component for all medical schools. Please do your research to see what each medical school requires, but for us, we do have a cutoff score, and for 2026 academic entry, it is 1,650. We accept SGD bandings of 1 to 3, but if any applicant presents with an SGD band of 4, they are automatically rejected. Now, personal statement, of course, all of you are aware that there's a new format of the personal statement, and here in my slides, you can see the 3 questions that you have to start preparing to answer. And although we do not formally assess the personal statement, I urge you to please take your time and just sit down and write it on your own without extra help, because it's going to help you immensely and prepare you for our assessment days. So what are we looking for in the personal statement is personal qualities, empathy, interpersonal skills, and ability to communicate, career exploration, which means understanding of medicine, any work experience or shadowing, and then any non-academic achievement like social involvement, what you do at school, things that have helped you to showcase your organizational abilities, interests, and hobbies. Now, I believe this is the most important thing, how we assess our application. So academic score is 25% of the process, UCAT score is 17.5, and the situational judgment test banding is 7.5. We take these first components into account, and then we rank the highest scoring applicants, and depending on the target of numbers that we have per fee rate, then we invite those successful to attend our assessment days. And as you can see, our assessment days are 50% of the process, which is half, which means that if you're successful to get invited, this is all to play for. Now, for our assessment days, I would say not approximately, we invite more than 800 applicants to attend them, and we introduced them in 2020, and for 2026 academic entry, we're going to offer in-person assessment day to Scottish fee rate and our UK ROI, but for overseas, it's normally online. I would urge you to follow the link in my presentation to just read about the core values outlined in the Medical Schools Council document, because this is where we have paced our assessment. Apologies for the typo, we have 3 stations. We used to have 4, but we have reduced them, so we have 3 stations, and each station is to be marked independently by one selector. This is a great opportunity to come and talk to us, chat to our student ambassadors, and ask them about their experience of the program. And also, during your assessment day, the selector that's going to be standing opposite you is going to be a member of the curriculum team. Now, in regards to decision making, I have an outline here in my slide just to give you an idea of when you expect to hear back from us. But in a nutshell, the deadline for medicine is the 15th of October, and beginning of November we receive the UCAT results, and then just after we receive the UCAT results, we start sending the invitations for the Scottish fee rate applicants. So our assessment days for Scottish fee rate take place in November and December, and our UK ROI, they are in January, as well as the overseas. So after the assessment day, we review the total application scores, we calculate how many offers we need to make based on our targets, and all offers are made by UCAT. So they are all conditional, even though if you have achieved grades, they're all conditional on the PVG certificates. And as you can understand, we typically have more applications in each fee status category than the places we have available. Now, why study medicine here at the University of Edinburgh? The University of Edinburgh is consistently ranked among the top universities globally for medicine. We are one of the oldest and most prestigious medical schools with a rich history of medical breakthroughs, and we have famous Edinburgh Medical School students, to include Charles Darwin and Benjamin Russ. We offer a spiral curriculum that revisits core topics, deepening understanding and integration, and students are taught and mentored by leading researchers and clinicians who are pioneering advances in medical research. We have a research-rich environment. We offer a range of Year 3 biomedical sciences honors programs in basic biological science, clinical sciences, and medical humanities. And this is just an outline of what we offer for our Year 3, which is the intercalated year of our degree. Our students, when they do their clinical years, which is years 4, 5, and 6 of our program, they get access to diverse clinical placements across Scotland and in leading hospitals. They have the options of rotating through some rural districts as well as urban and get involved with learning about medicine within both prosperous communities and socioeconomically deprived communities. And you get to find yourself living by the sea, access to the highlands and the beaches of East Lothian. We have international partnerships and exchange programs that allow our students to get global medical experience. And Edinburgh is a hub for biomedical research. These are some useful websites, and two of them are the Applying for Medicine online booklet. Please just visit this link. It has everything you need to know about our degree. And our admission statistics, they give you just an overview for the last 3 admission cycles of how many applications were received per fee rate and the average UCAT scores. Just to give you an indication of how competitive you could be for our MBCHP degree. And last but not least, this is a fantastic free online resource designed by NHS Scotland to help you apply to medical school. And it explores different pathways into medicine. You get practical advice on applications and interviews, and you can find out what support is available to you. Just simply scan the QR code in my slides, and it's a fantastic resource that has been introduced this year. And that is for me. Thank you for listening, and I will pass you on to the next speaker.
Thank you so much, Vasiliki. Now we have Rich from the University of Dundee. Thank you.
Thank you. Good afternoon, and thanks for inviting me through. I'm a pathologist by training, so usually they don't let me out of the basement back home. So getting to visit another city today is quite a treat. So I am also admissions lead through in Dundee, but I also run the first 3 years of the curriculum, so I'm convener for the first 3 years of the medical school. So I've got a good grasp, really, of what it takes to get into the medical school, but also what we offer throughout the medical school. I'm also a graduate from Dundee as well, so I've got a long period of insight into it. This is not our medical school on the screen behind us. This is the VNA, but it is now a contractual obligation for anyone working anywhere in Dundee that one of your slides has to have the VNA in it. I guess the point for putting it up there is that Dundee has changed a lot with time. Some of it has got worse, mainly our football teams, but the rest of the city has undergone a huge amount of regeneration. It's a lovely place to come. It's very much a student city these days, so the percentage of the population that are students is high. And you certainly notice when the students are in town and when it's certainly the summer holidays, there's definitely far less people around and about and much less of an atmosphere. Why should you come and study in Dundee? I think one of the reasons, again, for putting this up is I think you have to decide. I think if we're all honest, I think any medical school that you study at in the UK will give you a very good education. The Scottish medical schools are all ranked very highly. I think we were ranked, I think, first in Scotland a week ago in the Times and second in the UK, but everyone will have a ranking to share with you today. A lot of it will boil down to what suits you. You come to the city, experience the city, come to open days, have a look around the city, see which one suits you best. And then come to each of the schools, the medical schools, and see which one you think is a fit for you. We will all do the same exam now at the end of medical school. There's a medical licensing assessment. So we're now all working towards the same end point, even more so than we may have been in the past. So it's difficult to stand here and say that we're a million miles better than anybody else, because we're not. But you need to come and see us and meet some of the staff, see the university, see the city, and see if it's the right fit for you. We're a very practical course, we're a very practical faculty, so we have an integrated spiral curriculum as well, and that doesn't mean much sometimes to say it out loud, and I think a lot of our staff sometimes wonder what it means as well. But what it means from your point of view is that we're a very practically orientated course, and in Dundee we talk about being doctors from day one. We have an open door ward policy, so straight away in first year we've got very clinically applied course. So you do learn the basic sciences, but very much in context of what you need to know for when you graduate and what you need to learn to put those building blocks together for when you get into the clinical years in 4th and 5th year. Now, I'm a pathologist, so I fight hard for the basic sciences in the course, so they are there. And they're there in a very strong sense, but they're all there in a very applied sense as well. So random questions that are not relevant for you later on in your career, they're not the sort of things that we're interested in. So we're a very practical course. We pride ourselves on practical exposure throughout the years, and I think one of the things our graduates are well known for is that preparedness for practice. You hear a lot about resilience at school and trying to make people resilient, and I've never attended a session where someone's tried to make anybody resilient and thought that someone was more resilient after it. But we talk about resilience in doctors particularly, and I think the one thing that makes you resilient is knowing what you're doing, which sounds silly, but it's true. Anxiety and fear generally are fear of the unknown, and we want you to graduate in 5-6 years' time and be able to do the job. We want you to finish in 5th year having had all the experiences and done all the things that we need you to do, so that when you're doing them as an FY1 doctor, an FY2 doctor, you're far less anxious about it. If you're far less anxious about it, you're confident, you do well at your job, and you're more likely to stick at it for longer and enjoy it. So that's where we're coming from with our practical perspective. We're also quite practically minded when it comes to admissions as well. So we're very data driven now. We look at the numbers, and we really want to select the students that are going to progress well in the course and perform well in the course. We have changed dramatically what we're doing this year, so many of you will already have heard about multiple mini interviews, and we're not going to run them this year, and you'll hear about what we're doing instead shortly. I think we've almost all got the same academic scores, so the minimum for us is 4 A's and a B, but chemistry or biology, so you don't have to have chemistry, you can have one or the other. Like a lot of the other institutions, we do have a widening access policy as well, so if you fit one of the criteria on our website, there is a grade discount, so that's 3 A's and 2 B's, and we provide an uplift for the UCAT score as well. All of our offers for mainly Scottish students who are sitting hires will come with a condition, and typically that's 3 B's in S6, and that's either advanced hires or a crash hire in a separate subject, and one of them within a science. We will look at your UCAT score, but we don't have a minimum, and this is where we've differed a lot this year in our approach. So the thing that we've looked at, looking at our own data, the thing that predicts your performance best in medical school and your progression in medical school is your academic score, which is probably not a huge surprise. And we recognise that there are some people out there who are slightly disadvantaged, and hopefully our adjustments take care of that. The UCAT, I think, does provide some predictive validity, but not a huge amount. So we're using it as a secondary screening tool. So you will all be ranked initially on your academic score. So for example, if you have 100 out of 100 for your academic score, you will then be, all of those in that category will be ranked on the basis of their UCAT score. Everyone with 99 out of 100 will then be ranked on their UCAT score, and so on and so on. Then we provide a final layer of screening on top of that with the interview at the final stage. And as I said, the interviews now are the Dundee Medical Interview Selection Tool, because you have to have an acronym now, so DMIS, that's what we're doing. We looked at MMIs for a long period of time. We were a very early adopter of doing MMIs. And I think they did work quite well initially, but we have found with time that students who come and applicants who come to sit the MMIs know fine what's coming. And in fact, if you sit where you are just now with your laptops and Google Dundee Medical School MMIs, you've got a reasonable chance of finding most of the stations on the internet. I've sat on the other side of the table of MMIs a long, long period of time, and it's become increasingly difficult to differentiate between candidates because everybody says similar things. Everybody knows what's coming, so you can see a switch going in people's heads, and they think, okay, here's an ethics station, and there's almost a script that's delivered. So it didn't help us discriminate between our candidates at all. So we've developed this new tool, which is a group-based format. You'll be in a room with 6 other students for an observed discussion. We're going to present you with an ethical scenario and some prompts, and it's a reasonably controversial and tricky ethical scenario, and one that we hope you'll find challenging. So you'll have an opportunity to discuss that, introduce yourselves to the others within your group, and that's observed by an assessor. You'll then have a short break and go to another room for a facilitated discussion where bits of that conversation might be probed further or may wander off topic. Part of the reason for this, and a lot of the scenarios have been selected because they're essentially content agnostic. You shouldn't need to know much about the subject matter before answering the question. And in fact, if it just so happens you are a subject expert in it, you won't be any more advantaged than anybody else within those subjects. So it's less about what you're saying and it's more about how you're saying it. We've got a marking rubric that's going to look at your communication skills, both one-to-one, but obviously within that group setting, your professional values and behaviours, and your ability to work in a group. And that will provide the final part of the ranking. So the take-home message is that it's mainly your academic score that is the predominant weighting, a second layer of ranking based on UCAT, and then a final layer of ranking based on that interview performance. But as I said, come to Dundee, have a look around, go to the other universities as well, come to the medical schools, go to the open days and do the tours and see which place is the right fit for you. And you get a sense of a place sometimes, I think, when you visit it, and I think that's the important thing for you all to do. You'll no doubt have lots of questions, and please, I've got my email address, I think, on almost every slide there, and I know we've got Q&A at the end, but often you think of questions when you leave. So please jot down my email address and feel free to get in touch if you have any questions. Okay, thank you.
Thank you. And next we have Ines from Queen's University, Belfast. Welcome.
Thank you very much for including me. It's lovely to get a chance to give you a flavour of a medical school that's outside the fantastic group that you have here in Scotland. So we are the only medical school for undergraduates in Northern Ireland. You may know Northern Ireland's about a fifth the size of Scotland, a population of about 2 million. And Queen's itself is in Belfast, which is just here. About 500,000–600,000 people live in Belfast. But the medical school itself is a mere youngster compared to Edinburgh. It was 1835 that it was formed. The building, I wish I had a beautiful picture as you had in Dundee, but this is where the medical school is. It's in the medical biology building. All the labs and things are on the bottom 3 floors of this building. Clinical skills and simulation is over here. Case-based learning is here. All words I'll come to in a moment. The medical school offices and all our tutorial rooms are in a building in behind. But that comment about coming to see a place is well worth even doing it virtually, I think, is a way a lot of our youngsters have to do it at the moment, so that they can see a place that they're going to live for 5 years. Remember, though, when you're in the medical school, you have all of the other facilities that are in this university. So that's our library, the student union, the research facilities. And we're actually known now as a place for elite athletes. I'm going to dwell on this a little bit. It's a list of competencies or skills that you probably see in different formats on different websites, whether it's Medical School Council, the BMA, or the GMC. And majority of these are actually traits that you are already developing within yourselves. Okay, and the one thing a medical school will do is turn you out to be clinically competent as that F1 doctor. And you heard already that that is our aim, no matter which university you go to. We each were talking about our backgrounds, so I was the first in my family to go to university, never mind medical school. I went on to train as an obstetrician and gynecologist, so it's a specialty with a great mix of medicine and surgery. I think I'm the only one on the panel maybe with some surgical background. And I think like most of the doctors on the panel though today, we are using these skills on an almost daily basis. Okay, so when I'm in clinic talking to a mum about her pregnancy, hopefully I'm communicating reasonably well, empathizing from seeing things from her side of the view. And often, actually, it's involving ethical dilemmas. I enjoy being a lifelong learner, okay? But I actually owe it to my patients to be self-directed, to be motivated, and to keep up to date. And I certainly owe it to them to be honest and admit when I don't know the answer to a question. One of the joys of my job is actually working in delivery suite, where, you know, all of you were probably born in a delivery suite somewhere around this country. But it's also a fantastic place to see a team suddenly have to gather together very quickly when there's a complication or we need to go to theatre. And then, again, every doctor is constantly problem solving, collating information, and trying to help their patients make decisions about their own health. So this is a very busy slide, but what I want to say is at this stage, when you're deciding which medical school to choose, you will have many points that are important to you. That may be that you want somewhere close to home, that financially you need somewhere close to home, that you want some medical school that's small or large, in a city or in the rural area. All of those are important. I'm just going to pick on two today. One is, will they teach me in a way that I would enjoy? And the other is how we choose our students, which is what each of us are talking about. Please don't mind this being a very busy slide. Two things I'll point out from it. One is what looks like DNA down the side there. It doesn't matter what module or which part of the course you're doing, all our teaching is based on four things. We don't want to send you out just to be a doctor in Northern Ireland. We want you to take your space in the global setting. We want you to learn about preventing ill health as well as treating ill health. We really do want you to have a very good, strong core of clinical sciences so that you can take on board all the changes and innovations that you're going to have to absorb in your working career. We definitely want you to have the actual skills that you need to be that F1 doctor, the practical skills. But it probably surprises you that from the very beginning, we want to teach you how to work in a team. A lot of the time when you read your newspapers, something's gone wrong in the NHS, it's because a team did not work well together. The other thing I want to point out are the brown lines that run through here. So that you come in on day 1, you go out on day 5, and in every medical school, you should have covered the skills that you need to be that GMC registered doctor. What can be difficult is that you come into a lecture hall of this size, and you can immediately start to worry, am I doing enough? Am I keeping up with my friends? And that can mean that your own well-being then starts to get anxious and worried. And once you do that, you are then not performing as well as you could. So there are many ways that we give feedback and assessment to our students as they go through, but one of them is through progress testing, which happens 3 times every year over the first 4 years. And it will culminate in year 4 with an exam that's very similar to it, which is the medical licensing exam you heard about already. So first 2 years are called Foundations of Practice, and that's exactly to try and give you that clinical science that you need as the background. It's integrated, so when you learn about the heart, it'll be anatomy, physiology, biochemistry, pharmacology, pathology, all together. At the same time, you'll be learning how to take a history on a heart patient, how you'll do an examination on the cardiovascular system. From the very beginning, students are out in clinical practice. But to begin with, there's first of all attached to a family where there's somebody with a chronic illness. Okay. Most medical students come to medical school and have not actually had anybody in their family with a chronic illness. So this gives them a chance to see what it's like being an NHS patient, but from the other side of the fence, not the doctor's side. It also helps them to immediately from the very beginning realise when you have a patient in front of you, it's actually everything that's going on in the background in their family that will affect how their illness progresses as well as how you will treat them. That morphs into general practice, and by halfway through second year, people are out in the hospital setting. Clinical skills, you will see lots of pictures of clinical skills. We are our aim really is that from the very beginning, it's not that you're learning to feel an abdomen on a plastic abdomen, but you're doing it with our simulated patients, that you're learning from the very beginning to have that conversation with your patient and put them at ease. A couple of slides back, I had the words case-based learning up, okay? And this is one of the things that underpins our teaching from the beginning. For two reasons. It helps our students learn to work as a team, but also it from the very beginning, how is the science that I'm learning at the moment, how does it actually apply to cases clinically later on? So students will be in groups of 10. You might be doing respiratory. We give you a case of a child with asthma. All the core knowledge that you need to answer that case, or the majority of it, will be in the lectures and the clinical skills and everything that you're doing at the time. But what you're doing here is learning that if you divvy out the work between each of you, and each of you does a small bit, how suddenly you'll come up with a very comprehensive answer to the case. But what you're also learning, how to run a meeting, how to be the chair, how to be the secretary, and how to be a good team worker. Third and fourth is where you're immersed in practice, so you're out in hospitals all the time around Northern Ireland, and you float in and out of the same general practice all through those 2 years, so that by the end of fourth year, students are actually able to see patients independently in their general practice, and then make sure that the GP has seen and signed off. These are the hospitals around Northern Ireland that you wouldn't be familiar with. The furthest one away would be just about an hour and a half. But when our students are out in those, all their core lectures are online. We've had this long before COVID. It means that your core knowledge is there when you need it. At the time of year you need it, you can go back for revision. And they're proper lectures with films. They're not of teachers. It's not just sitting with the PDF slides. Our clinical skills at this stage turns back to being what we call interprofessional. So this is the unit, and just taking the simplest of pictures there, paediatric nurses, paediatric medical students working together to look after a sick child who happens to be choking. The same area is very much all about a much more immersive simulation. So you might be learning in your emergency attachment, to treat somebody at a roadside. And the pictures, instead of it being a helicopter, would actually be of crashed cars on the side, the crowd gathering on the side, the smell of burnt rubber, maybe even petrol. Everything that makes that simulation more realistic. I said you do your written paper at the end of fourth year. It leads straight into an elective, which you can do medicine wherever you want, in whatever format you want, and then the rest of fifth year is about preparing you for practice, ending with an assistantship where you're actually working with and following foundation doctors. The aim is to make it seamless from that being a student to being a doctor. So before I go on to just how we choose our students, there's many of you in the audience who would be worried that medicine is not for you, perhaps because of a learning need or a physical disability or an illness. It's already been broached on by the first speaker. I'd encourage you to read this document by the GMC, Welcomed and Valued, but I'd also encourage all of you to just talk to the medical schools that you're applying to make sure you get the reassurance of the support you would get on that degree. Okay, so then just very quickly, how do we choose our students? Well, we have 236 home places, that's home fees, which people from Scotland will be applying for, but we're very different to the schools in Scotland in that we have no quotas for whether you're from Northern Ireland or Great Britain, whether you're a school leaver or graduate, okay? It's entirely open in that way. So the selection, therefore, is very simple. We select you pre-interview based on your exam results and your UCAT, and then the offers are based on your ranking at interview. So the interview is very important with us. Normally the academic score is based on GCSEs, so the maximum is 36 points that you will get with it, but with Scottish Highers, we base it on the 5 that you took at first attempt, okay? And again, the maximum you could get pre-interview is 36 points. We then add your UCAT, okay? And for the last sort of 15 years, we have had our own banding for UCAT, which is published. When you knew your UCAT score, you knew how many points you would get towards your UCAT. And that was a maximum of 6. So our top score would have been 42. And we work our way from 42 downwards, giving out at least 700 places for interview. We published the last 10 years' results of the thresholds for people, but I've put it up here for just so that you realise, please don't be put off by pre-interview scores you might see for the last previous 3 years, okay? We have interviewed the same number of candidates all the way through these years, but during COVID, or because of COVID, you can see centre assessed grades raised the pre-interview score. We're really glad to see that our pre-interview score for the people who came in this September is now back to where it was pre-COVID. The difficulty for you all is obviously that UCAT has changed this year. So instead of it being out of 3600, it's now 2700. Okay. So the academic score will stay the same. And the UCAT has gone up to 9 marks, but we'll use the deciles that are already published on the UCAT website. So for this year, we will be a maximum of 45 points pre-interview, and we'll be working our way down that to give as many places for interview as we can. Personal statement was mentioned and how it has changed to being 3 questions. Don't be disappointed if I say that Queen's has never scored your personal statement. We simply want you to be explicit that you've done medicine. And that was simply because we knew all along that across Northern Ireland, some students would find it incredibly difficult to get any work experience or even volunteer experience in the care sector. But I know you are putting a lot of time into writing it, and all of the effort that you've put into that will really shine when you're actually doing your interviews. So interviews themselves, like Dundee, we've had MMIs for a long time. We started in 2009, and we're continuing for the moment. But the 4 things that we're looking for are your moral reasoning, your communication, your empathy, and your problem-solving skills. And all of that is published again on the website. The interviews are face-to-face when you're applying for home fees, and you have 9 stations. Okay, so 9 different interviewers will get a chance to assess you. Or turn it the other way around, you will have 9 different opportunities to show yourselves at different stations. There's 1 minute to read before you go in. There's 5 minutes in the station. Half the stations are direct questions, but half have role players where you're actually running through a scenario. So once you come for interview, everybody is on an even playing field. It doesn't matter if you were 42 points or 32 points last year. You had the same opportunity at interview. And then once you come in, the offer is that you'll get will tell you which A levels that you require. So this is if it's 3 A levels. Some of you might be doing an AS or have an EPQ. And this is our Scottish higher requirements. You can see that they vary depending on, at advanced level, depending on the hires that you're offering. Okay. I'm going to leave it at that. I would really encourage you, this document here, how we choose our students, has all of the information on it that I've gone through, but the last point is this email, admissions.med@QUB. It's just a direct email only for admissions for medicine if you've got any particular questions. I hope your journey starts here. Thank you very much.
Thank you. And so our final speaker is Chris from the University of Glasgow. And as before, continue to put your questions up through Slido, either for a specific speaker or in general, and then we will go through them after. Welcome.
Thank you very much. Good evening, good evening. So all the hard work, so thanks guys, that was great. So I really just going to have a very brief chat about Glasgow, but I think everything you need to know about how to apply to do medicine has been covered, and I really do think that the most important thing about choosing a medical school is finding a place you think you can spend 5 or 6 years. So visit the schools, you'll get a vibe to see if you think it's the right place. So what I'm going to briefly talk about is why Glasgow. One of my roles as I'm an endocrinologist, I'm a physician to trade, and I'm the head of the admissions team, but we also have a Scottish admissions group, so the national picture is quite revealing, and hopefully you'll find it quite reassuring. And then we'll go through some of our local data, and then I'll talk to you about Gateway. Gateway is a programme that other universities also run, but it's a widening access programme. So why Glasgow? Well, essentially, you end up with the same degree. So Glasgow's from a student's perspective, I think, is certainly for the first 3 years, you're campus-based. So the University Medical School is on University Avenue, so you're smack bang in the middle of the West End. The new building across the road is where the lectures are. There's a 500-seated lecture theatre. So you're basically in with the rest of the university. So it's quite a vibrant place to be. Like many of the medical schools, you get clinical exposure from your first term. So you're involved in vocational studies and general practice, and you also get hospital visits from the first term. There's a few nice wee features of student selected components. So you get 4 or 5 5-week blocks where you choose a topic. You either choose one that's already organised for you, or you can choose one, you can design one yourself. And these range basically anything in the university. You can have 5 weeks of doing medical Spanish. So there's a whole pile of components that you can add into the course to make it suit you, I guess. So there's COMET, which is a community-based medical degree. Well, it's the same degree, but from third year you do more. If you think, I want to be a general practitioner, I know I want to be a general practitioner, then there's one of the streams of education is much more primary care-based. Prep for practice, like many of the other universities, you spend 4 or 5 weeks just before you start work, shadowing the FY1 teams, learning about that. You can do your intercalated BSc in third year. So if you want to spend 6 years at university and do a BSc, then you can do a BSc after third year. If you'd rather just spend 5 years, then that option's there for you as well. One of the most important aspects of this is training good doctors, but you have to be able to look after yourself, and you have to have other interests in life to keep you kind of hale and hearty. So the university medical school policy for Wednesday afternoons is the university sports afternoon for the whole of the UK, and no subjects are taught on a Wednesday afternoon. So very, very important if you're a representative athlete, or if you like somebody who likes playing badminton with their pals, you will always have Wednesday afternoon held for sport and recreation, and I think that's really, really important. The final phase is a 2.5-year clinical phase, so that's based in hospitals all around the west of Scotland. And I suppose, come and look at Glasgow. I think it's a vibrant city. Come and look at the West End. Come and look at Dundee. You're already in Edinburgh. So I think the really important part is go to the place you want to go and understand what the place you're going to study in looks like. Now, so I'll give you a national overview, which hopefully will reassure you. This is somebody trying to work out the calculus about which university to apply for. But Scottish University post-COVID funds over 1,300 places for medical students in Scotland. 80% of those are nominally for home students. So over 1,000 funded places in Scotland for home being Scottish, not home being staying at home. Last year, the A100 applicants, I looked at UCAS before doing this, there was 1,250 unique A100 applicants across Scotland. That means there's 1,250 people in Scotland who have applied to do medicine. So you can see already that there are more than enough medical school places in Scotland. And these are 1,250 people who have applied. If you look at the applications, some of them don't actually meet minimum requirements for any of the medical schools. So last year, we got 930 applicants. We interviewed 623 applicants, and of those 623, we offered 451 places, which was to fill our home 280 places we have for home students. So the admissions criteria are more or less the same. In fact, they are the same as all the other medical schools. So it's 4 A's and a B. the key thing is that it's at first sitting and a single attempt. And that is absolutely, there's no leeway on that. So we've had people in the past that have done a higher in fourth year, and then all the medical schools expect this, and I've done this because the admin team told me, please remind everybody, because the number of questions we get about this. Personal statements, again, like the other universities, there's no personal statements, particularly now, there's nothing to. They're very, very useful for you to collect your thoughts and organise all the different qualities you have and things you will bring to medicine. And they're phenomenally important if you come to interview. Not that we mark them in any way whatsoever, but if you read your personal statement, it's a great place to be if you're about to be interviewed. But we do not mark them. As long as it's clear that you want to apply for medicine in your personal statement, that's it. UCAT is changing this year, but we use UCAT to rank the applicants. Okay, we've looked at the R value for UCAT and your final scores, and it's of very limited value, but it's quite a useful tool to rank the number of applicants we have. And we offer, our conditions are 2Bs at advanced higher if you do get an offer. So we have an adjusted entry. I think the Scottish Government, and actually I think society needs to, the people that are looking after you, the medical staff, need to represent the society that they're looking after. So we have an adjusted entry programme in Glasgow, much like all the other universities. We look at your decile, so you can work out your postcode decile, look at going onto the SMD website. So we will adjust offers for people from the lower 2 quintiles, people who are care experienced, asylum seekers. So there's a list of things, or people from the Western Isles. The Western Isles, because actually your ability to study quite a lot of the subjects is very restricted, as opposed to having some sort of particular entry requirement for people from the Western Isles. And the adjusted entry, if you fulfil those criteria, is, again, a reduction in the academic grades. So 3 A's and 2 B's, or 4 A's and a C. We also give an uplift to UCAT of between 10 and 20%, depending on which one of the criteria that you met. And the conditional offer, if you have an adjusted entrant, is a B and a C at advanced higher. So there's slight changes to reflect the life opportunities you would have had if you're one of the adjusted entry candidates. So we've interviewed for many, many, many years, and it's online. The interviews are online post-COVID, but they're online as well because it reflects the university's sustainability policies. We've got a global climate crisis, and bringing almost 1,000 or over 1,000 people now to Glasgow to interview them is not justifiable from a climate perspective. It also reduces our equity and our Q1 candidates, because actually coming to Glasgow in itself is quite expensive. So needing accommodation is quite expensive. So we do all the interviews on Zoom. There's 2 interviewers. The interviewers are trained in the interview itself, and they've all got their equality qualifications. It's a structured interview, and what that means is there's specific questions which are asked, and every candidate gets asked the same questions. The questions change year on year, but the idea is that the only change in the interview is the candidate and not the questions asked. And that style of interview has been shown to be as fair as you can make an interview. So it tries to reduce any bias. The other way of reducing bias is the interviewers know nothing about the candidates. So it's a complete clean slate. And like any other assessment, we're looking for people. There's an ethical part to the interview. There's questions regarding teamworking and communication, on self-improvement and challenges that you've faced. And there's questions about trying to explore your genuine insight into medicine. And the score at the interview is what determines your offer. Once we've gone through the selection process to interview, you start off with, everybody starts off with 0. So your performance at interview is what determines your likelihood of having an offer. And I dug out some of the results from 2 years ago, so I haven't quite processed the ones from this year. These are the Scottish school applicants. So there's also lots of postgraduate applicants. So the school applicants, you can see the majority come from quintile 5, which will make up the majority of this room, I'm sure. But you can see that about 80% of people that apply from each quintile will end up with an interview, and about 80% of the people that are interviewed will end up with an offer. So and that's a consistency across every year. So if you apply and if you get an interview, you've got an extremely good chance of getting an offer. So Gateway is a specific programme looking to widening access to medicine and to a tertiary education for people who would traditionally not have managed to come to university. So it looks purely at people from SMD Q1, which is the lowest 20% of postcodes, or pupils who are REACH eligible and who are a carer or are cared for or from the island cluster. And the entry into the Gateway programme is 2 A's and 2 B's in a single year. And passing all your subjects in 6th year. And what the Gateway programme is, it's a 1-year biochemical bioscience course. And if you score a B grade average in that 1 year, you're automatically given a place in 1st year of medicine the following year. There's no more interviewing, no more assessments. If you don't achieve a B grade, then you will get a life science entry into a 2nd year of a life science. So it's taking people that would never have normally gone to university, who've had challenges in their education, and giving them a 1-year course. To get a B grade average, you have to excel. So you have to be academically very competent to get that. So I've got a few of the questions the admin team, the admissions team highlighted to remember to tell you. So 6 hires is no better than 5 hires. So 5 hires is what we're assessing. So by all means do 6 hires, but you can reflect on that. Face-to-face medical work experience is not required in any medical school in Scotland. It's recognised as a relatively, it reflects your postcode. So it's very difficult for some people to get face-to-face medical experience, and very easy if your dad's pal plays golf and is a doctor. So what we are looking for is evidence of people volunteering in the health sector, or I'm sure if people weren't doing assessments, one of the really, really strong things is people have got Saturday jobs, because they are good communicators, they're good at working in teams, they've faced challenges, they've got to balance lots of stuff. It's quite interesting kind of when it comes to an interview. McDonald's seems to be a place where you learn lots and lots of challenging experiences. So just to remind you, 4 A's and a B at a single sitting. That's the key thing. You can do a crash hire, a mandatory crash hire in 6th year, but you have to have already had the grades in 5th year. So I think that's the questions the admin team get asked most often. So that is also me. So thank you very much for listening.
Great. So now we've heard from our 4 universities here, we're going to go into some questions. And it'd be great to hear from some of you in person. And if you're feeling brave enough for that, we'd ask you to come up to one of our microphones, either in the centre or on the side. And the same for our panel. You need to press the button so that we can hear you, and those online can hear what's being said as well. And I will just start us off with a Slido question. So someone has asked, if you barely meet the UCAT cutoff, should you still submit an application? So if anyone would like to take this question. So if you barely meet the UCAT cutoff, should you still submit an application?
So from Dundee, yes. We don't have a specific UCAT threshold. We're aware that year on year, and particularly this year, the performance in UCAT can change slightly. So we don't have a specific lower threshold.
Likewise, Queens, we don't have a lower threshold. So if somebody can do really well in your hires and less well in the UCAT, that will balance out. Somebody who did very well in the UCAT, less well in the academic score.
Where are we? Again, in Glasgow, we don't have a cut-off per se. We do use the UCAT as a way of screening at the very end. So it's difficult this year, in as much as it's a brand new scoring for UCAT. Our generally 2,500 was where our cut-off would, or our slice would come. which I think will end up being about 1,800, but we have no experience of the new scoring system, so I would continue to apply.
For the University of Edinburgh independence, so you'll know that we have a cut-off score, and this is 1,650 for 2026 entry, so it depends on the fee rate. So those fee rates are really, really competitive, so I would say a risky application. If you're just meeting the cut-off, it would be RUK and overseas. We do see a lot of competitive applications there. So I would say if you fall into this fee rate, then it's really, really risky. If you're on the Scottish fee rate, what I would encourage you to do is to email us with your profile, and then we will get in touch to advise you if it would be risky or not. All right? Thank you.
Okay, and we've got one here. It says, for Edinburgh or other unis as well, what kind of global exchange opportunities are there? So Vasiliki, do you want to start?
I'm afraid I don't know a lot about this. I'm so sorry. I'm not part of the curriculum team, but I know that we have a lot of international partnerships, so I'm pretty sure there are a lot of opportunities to go as and even do an elective or do study abroad. I definitely know that this is an option, so please do go on our website or email us and I can get an answer for you. Thank you.
Okay, we're moving along this way again. So for Glasgow, yes, we've got 2 electives. So what that means is you've got 2 opportunities to go and study abroad. There's a number of allied medical schools, but essentially you can go anywhere you want in the world. For reasons which I'm not entirely sure why, I run the exchange with Copenhagen University. So I take students from Copenhagen every year and we send students back to Copenhagen. But essentially you can choose to go anywhere in the world for 4-week blocks in the summer.
Carry along.
So we did have Erasmus, so 4th year students used to go to I've lost my light. Yes, it's gone on again. The links were Heidelberg, Berlin, Oviedo in Spain. That has stopped just at the moment because of we're no longer in Erasmus. But then, as I said, students spend about 6 weeks on the summer between year 4 and 6, and year 4 and 5. And that's very much up to the students. I'm sure all of the medical schools would have this vast library of information where students will hand on from year to year where they went for experience.
Yeah, much the same as everybody else actually. So we have a 10-week period in our 4th year, 8 weeks of which are the elective component in Dundee, and there are 1 or 2 restrictions, but very, very few. And for a small number of students, it does become a competition to see who can go to the most obscure place. But certainly, it's certainly a highlight for almost all medical students wherever they go, I think.
Do we have anyone in the audience who'd like to ask a question? Just raise your hand. Yeah. I think your closest mic is just down there, and just press the button.
So I know for one of the schools, 6 hires was the same as 5 hires. I was wondering if this was the same for all the other schools.
Okay. Should we start?
Yes, it is for us. So
Yes.
you won't get any additional points for 6 hires instead of 5 hires.
Likewise for Queen's. 5 is what we're asking for. Thank you.
Same for Edinburgh. We do look at 5 hires, and definitely to meet the required subjects with this chemistry and 1 from the other sciences, biology, maths or physics.
Thank you.
Yep, great. And so another question from Slido. If you're planning a gap year, when should you sit your UCAT or apply? Do you offer any deferred places? Should we start at this end?
Okay, so for Edinburgh Medical School, in regards to deferred entry, we do not accept any request unless it comes from international applicants that they're doing mandatory national service. So if you're doing a gap year, you have to mention that in your personal statement and explain why you did that. And we expect that it has been a productive year for you, and you have done things just to help you just come closer to understanding why you want to study medicine. But if you're doing a gap year, then you have to sit the UCAT test in the summer that you intend to apply. So if, for example, you had taken a gap year in 2025 and you intend to apply for 2026 entry, this means that you have to sit the UCAT test in the summer of 2025 just ahead of the deadline of the 15th of October 2025, okay?
Anyone else? Anything to add? Yeah.
Okay. So we will defer. So I guess there's two ways to apply. You can apply at the end of 6th year, and if you're successful and get a place, you can choose to defer. If you want, you have to ask, and you have to have a reasonable plan, but we're fairly accommodating. I think the key I guess one of the key questions, or the key answer to that part of this question was, you have to sit your UCAT in the year that you're applying, so which is standard. So, but if you do apply to us and you get in and you suddenly think, actually, I think I'll be a better person by taking a year and going and learning stuff abroad or doing something for a gap year, we will defer your place the following year. And you don't then need to reapply. You basically got your place booked.
So it's likewise for us, you have to do UCAT the same year as you're applying. But if you think it through carefully, if you make an application in your last year of school and it doesn't work for you, you have the opportunity to apply again the next year. Does that make sense? So I would encourage people to apply and then tell us that you're deferring. The only time that we don't like people to tell us they're deferring is if we're giving you an offer out in the August, when results have come out and we find we have spaces at that stage, we would prefer not to defer. Also, many people apply to us and they don't know that they want to defer because the opportunity to go and teach in New Zealand for a year only arrives maybe in the March of, just before you do your exams. So I'd encourage you to apply when you have the opportunity.
Going on and off. Hopefully you can hear me anyway. We don't accept deferrals, only in specific exceptional circumstances. In Dundee, would we accept a deferral? As you've heard, you do need to sit the UCAT in the year you're applying. I think as a general life advice, I think a gap year is a sensible idea. I think increasingly school prepares you for all sitting the same exams. You've heard that medical school is now preparing you all to sit the same set of exams. And medical careers can be a bit of a runaway train. Once you're on it, you feel like you can't get off. And I think any of us working clinically here appreciates working with colleagues who've got different experiences, different skill sets, and there's no good or bad time to accrue those experiences. And I think a gap year is a sensible thing if it's right for you.
Lovely. Any other questions from the room? Yeah, up at the back. Yes.
Can you hear me? I think I'm being stupid. So can Glasgow or Belfast, who allow deferrals, just explain? So if you're an S6, you do your UCAT, you apply, you then decide to take a year off. You have to do you offer a place, you ask for deferral. You then need that student to do the UCAT again the following. No.
I can answer this one. So if you're in 6th year and you apply and you are successful in being offered a place to start medical school in Glasgow, but before you start, you email us to say, actually, things have changed. I've got an opportunity to go here and do this. Can I move my place to the following year? Then we just move your place to the following year. So you've automatically got a place the following year. And we would be very supportive if your year out or your gap year was something that was going to make you a better person. And I think I would take a gap year if I was anybody.
Okay. And so our next question, what advice would you have for someone who is not totally sure about a career in medicine? I think I was in this position, certainly when I was in 5th or 6th year of high school, and I just thought I would give it a go, see how it went, and 15 years later, I don't regret it. But along that way, a lot of people I was at university with have gone into different parts of medicine that are completely different to one another, whether you're a very practical person, a people person, or want to do something completely different. Medicine is a useful degree, and once you've gone into medical school, it's not closing the door to everything else. I think there's always flexibility. That would be my thoughts on it, but I wonder what the panel feel. So for someone who's not quite sure about whether medicine is for them.
No, I would echo that. It's not a one-way street, and I think certainly you can go on to do various things with a medical degree. It will hold you in good stead. There's lots of transferable skills, but even within medicine as a career, you can see the diverse number of careers even in the panel here, but there's opportunities to do so much more now than there were previously. So law, journalism, sports medicine, all sorts of things are available to you. But just to reiterate, I think what all the panellists have said as well about work experience. Don't do work experience for us to tick the box, do work experience for you. And even that's challenging, because actually it's difficult to see what the job is like unless you're doing the job. And in medicine that can take a long time to happen. But speak to doctors, go out and see doctors and see what doctors are doing, and see if you enjoy it, see if you think it's the right fit for you.
I'd echo that. Whilst we don't say people have to have work experience, it is a great thing for the person who's not sure, or the person who might be sitting in the audience. I'm not sure if it's medicine or dentistry I want to do, or medicine and pharmacy. That's the time to really go see what the job is like, if you can.
I might take a slightly contrarian view then. I think if you're not sure, I'm not sure I would apply. I think if you're not sure and you start the medical degree, it's a long degree and you'll not enjoy it. I think what you might not have reflected on as a young person about to embark on tertiary study and then work, you'll be working till you're 70. There's no rush. So if you're not sure about what you want to do something, do another degree. 25% of the admissions will be postgraduates, and I'm sure where clinical colleagues will agree, postgraduate medical students and therefore postgraduate doctors tend to have, they're very obvious in the FY1, FY2 years. They're much more experienced, they're much more mature, they're much better decision makers, and they will be 25 years old, so they've still got sort of 45 years of work left in them. So I think sometimes in schools are, guilty of this. It's almost like you think there's this cliff edge that at the end of 6th year, if you haven't got your application in to do medicine, that's the end. I think it's definitely not a cliff edge. And now that the date of retirement's gone from 60 up to 67, and it'll be 70, it might be a lot older than that, I would enter medicine having really thought about it and not rushed. So if you're not sure, do a degree in something you really think is interesting, and then over those 3 or 4 years, depending on where you do your degree, you can do some work experience, you can work as an auxiliary, you can get some work in hospitals and phlebotomy, you can really, really learn, you get paid as well, so you can have your part-time job, and then you'll go into medicine as an extremely, extremely accomplished postgraduate in a degree that's very interesting. You'll bring that with you, and you'll be a much, much more accomplished, and you'd be a better student, and I think as good, if not a better, FY1, FY2.
Yeah, I would agree with my colleague here. If you're not sure, what I would urge you to do is just go to as many open days as possible and just talk to our current students and check their experience on program and what has driven them to apply to medicine. But then, of course, there are so many degrees that they offer graduate entry to medicine, and we also do that for our MBCHP program. We also have an alternative route, which is HCP Med for healthcare professionals, which is a unique degree that's in Scotland, and it is aimed for qualified healthcare professionals that they live and work in Scotland. So for example, we have a lot of pharmacists that they do this degree. We have nurses, we have paramedics, radiologists, sonographers, we have occupational therapy. So they come in and do this degree, and they do 3 years part-time and online, and then the last 2 years they do their clinical placements, and actually they're very accomplished healthcare professionals, and they do medicine now in this time of their life, like really understanding why they want to do that, and they actually really enjoy it. So yeah.
Thank you, that's some interesting thoughts there. And so we have a question here asking, how high is the workload compared to, say, S5 or S6? So we start at this end again.
It's a different kind of learning, I think, is the point. I don't think anything in medicine is particularly difficult conceptually. So it's not like a philosophy course, or we're not going to ask you about quantum mechanics, things that are difficult to get your head around. The one thing there is a high volume of facts. So if you're someone that can cope with learning a high volume of facts, then I think that's the sort of thing for you. There are problem-solving issues and all sorts of things to stretch yourself with as well, but that's the kind of learning. And I'd be interested to hear what colleagues think, but certainly as year 1 to 3 lead, it's a different style of learning, I think. So you won't be coached quite as well as you may have been at school, and certainly a lot of our students in the first semester struggle with a different style of learning that's really far more self-directed. So we've spent a lot of time over the last 3-4 years, if not longer, trying to help our new students, and particularly our school leavers, with new study techniques, buddying them up with senior students who've done it and have made the mistakes, if you like, and try and hope that you don't make the same mistakes. But it's something that we've worked very hard at in Dundee, is to make sure that we support you with that transition in style of learning. So I don't think it's harder, I think it's different.
I think the exams that you do at the end of school are one of the hardest that you do, because of the pressure that's on you to try and get results at that stage, isn't there? And when you come into medical school, yes, it's a different way. Our aim is to gradually change you into an independent learner. But that's why I talked about that the core lectures and the core information is taught to begin with a small proportion being the small group and tutorials. But by the time you're in 3rd year, you're an independent learner. So it's different in that way. But I honestly wouldn't think that the volume is actually, the whole idea of why we ask for a group of subjects together. You asked about the 5 hires, about the certain number of advanced hires, whether it's A levels. That's showing that you can cope with a certain volume of work happening at the same time. Okay? So you're demonstrating it in school.
Yeah, I agree. I mean, I think you have to be academically able to get the grades to get into medicine. After that, it's no more academically challenging per se. It's just that the style is completely different. So schools are, my children have all left school now. Schools were an exam passing machine, as far as I could see. They were coached coached forever about how to get the best grades they could get. Universities much more self-directed. Particularly as a 17 or 18-year-old, there's lots of other distractions. You're suddenly away from home. The challenge is trying to stay grounded in the first term and apply yourself. But if you're academically able to get into medical school, you will manage. You might have a wee blip on the way, particularly the first exams in Christmas. I think people often find quite hard, but I think that's more a reflection of the huge change in their life that coming to university and moving away from home.
Also, it's university have their own, as I say, they call them as academic families. We call them student advisors. So definitely you can get in touch with your student advisor and ask for support in your learning, especially if you need any special adjustments. But I'm pretty sure you're going to have so many peers that they're going to have so many things that they can share with you, like for example apps that that can help you memorize things. So I think it's just the volume that you need to anticipate. But other than that, if you have managed to get the grades, then it means that you have consistency in your learning and you will be able to cope with the workload.
Any other questions from our in-person audience? Okay. And so we have a question here. How shall I prepare for my interview? Should we start with Edinburgh?
Oh, yeah, okay. So as I mentioned, we don't have multi-mini interviews, we have assessment days. And although we do not score the personal statement, whatever you write is definitely going to prepare you for the assessment days. And as you would have guessed, what we're looking for to showcase on the day is why you really want to become a doctor. What has led you to think about this as an option, as a career, which means any experience you have, we're not expecting you to have been for 20 hours in a GP practice, shadowing someone, asking questions from patients. We value quality over quantity. So we want reflection. So while you're on the day, we want you to think about as many examples as possible. Reflection on your experience. It can be anything, talking to a nurse, to a pharmacist, to a doctor about their experience, and then bringing this during the assessment day. You've also noticed from my presentation that I have a link to the core attributes from the General Medical Council. Please follow this link. We also have this available on our website, and just read through what we're looking for from future doctors. And that is going to help you prepare. We don't try to catch you out on the interview. We really have an interest to see why you want to study medicine. And at the end, after you finish the day, you might want to think like, actually, I don't think I want to do that. Again, that is going to be a gain for you because it's a big journey. It's 5 or 6 years and then 2 more years foundation, and then to think about what I want to pursue. Do I want to become a GP? Do I want to just pursue a specialty? So all of this is a good thing to start thinking while preparing for the assessment days.
Yeah, I mean, I agree. You've seen all the core skills and attributes that you'd expect in a good doctor displayed on various slides this afternoon, this evening, and the interview in Glasgow really explores those key themes and asks really for you to evidence that you're how you demonstrate those key themes. So going back to the personal statements, when they're written, actually are quite a good summary of all of your key attributes, key skills, and key experiences. So if you were just to think about your personal statement, then a lot of what we will ask, you can map back to that, as well as an ethical scenario, obviously. So it's not designed none of the interviews are designed to catch you out. We want you to come. So think about your personal statement.
I think if I listen to students talking to other students how to prepare, hear your own voice out loud. So at the tea table tonight, when you're at home with your parents, no silence. Just chat about, I don't know, was it the football match that went on at the weekend? Was it the racing and the who did well? Start to see things from both sides of an argument. Okay, might be something else that was on the news. Something medical that was on the news. We're not expecting medical knowledge out of journals, but there will be topical topics that may come up. And the other thing that the students will tell me is when you're thinking of your answers, it's one thing to formulate it in your mind. We can all do that. But actually to hear yourself say it out loud. They would say that's really important. When the students come to do role plays with us, they will say they're so much easier to do those with us, with our real actors, than they are when they were trying to practice it with friends at home. Because when they do it with us, nobody will see them again. You know, they can be themselves. Whereas when you're practicing interview questions with your friends or your teachers or your parents, you think they'll remember what you said. Okay, so that the one thing it's about, people talk about going in courses and things, and we find that those, as you mentioned, they sound very practiced, and you can sometimes hear the same answer coming out several times, and interviewers pick that up, that this wasn't the person talking, it was them thinking, this is a good example I heard and I'm going to give it. Okay? Are those very practical points?
It's rubbish going last. Everyone's given all the advice already. But yes, no, I agree. Relax. We're not there to be terrifying, to scare you. We want you to come and work with us. You know, you've heard lots of times already, it's a long career. You're only medical students for a relatively short period of that. So we're looking at you as future colleagues, not future students. So we're looking for real people, people that can speak for themselves, people that have a degree of honesty about them, people that can think for themselves as well. And I think the advice about, you know, things in the press, things you've seen on TV, get used to having conversations about them, get used to thinking about what your opinion is, challenging others' opinion, but letting your opinion be challenged as well, which I think is an important thing. But I think on the day, relax. We're just looking for sensible people and a bit of common sense, although common sense is often not terribly common. So yeah, I think relax about it and treat it as if it's a normal conversation.
Okay. And another question here is, how important is non-medical work experience, e.g. working in a shop, and is the length of time important, i.e. 6 months versus 2 years? I think we heard mention of Saturday job earlier, but do you want to start at this end?
I think it's very difficult, actually. It would be difficult to have a scoring system, wouldn't it, if we said you got 3 points for a year and 2 points for 6 months. So we don't look at it. Again, we're looking for life experience to come across in your face-to-face interview. So if you have done a Saturday job, if that's McDonald's or otherwise, McDonald's is obviously rough in Glasgow, by the sound of it.
I wouldn't like to work there.
Then that comes across in your interview. We can tell that you're used to dealing with the public, you're used to having conversations, you're used to having conversations with people you've not met before. And that's one of the reasons, that's one of the things we're looking for, is that level of life experience, so not necessarily just work experience. And that can come from employment, but it can come from volunteering, it can come from all sorts of places, but we want to see that come through in your interview.
And it's also not the experience of a 40-year-old. It's your age group. So when you're giving examples, it's examples that are relevant to you and your age group. You could spend 2 years doing work experience in a hospital, watching something, and actually not have taken anything in. Does that make sense? It's reflecting on what everybody else in the room was doing, what effect did it have on them, what effect did it have on you. That's really what we're getting across. And the other thing is work. You could be in the newsagent on a Saturday or the co-op. Just think of everything on that list that you're demonstrating. You might be the one who opens the shop at 7 in the morning. You're dependable. You're honest with the money. You're dealing with people who are complaining. You are turning up when you could be doing something else on a Saturday night, perhaps. I'm going on a little bit there, but you can get all of the things that are on that list from having, for the people who have to do a paid work employment on a Saturday and can't give up time to volunteer.
Yeah, I mean, I think the difference between work experience where you're working on a Saturday job or working or volunteering is you are actively demonstrating communication, teamwork, conflict resolution, whereas if you're passively observing a doctor, it's a very passive process. So you will watch somebody else do something. We're not particularly interested in you watching somebody doing something, but I think we're much more interested in any of the medical schools about your teamwork skills, your communication skills, your ability to deal with conflict, your ability to deal with ethical scenarios, as opposed to having watched somebody else do it. And I think that's when I'm interviewing, particularly the way we interview, it's very obvious. People will say, I saw this, which is interesting, whereas we're more interested in people that have done this. Here's an example of something that we did. So that's where I think volunteering or working gives you the active learning and the active experience, as opposed to watching, which gives you a very passive experience.
I don't have anything further to add. I think all of this definitely captures the essence.
Yeah. And slightly similar but a different aspect. Does it matter if I've not done volunteering due to not having time because of playing sport to a high and demanding level?
Okay, so yeah, I don't think it matters. I mean, but we do have applications from so-called elite athletes. So if you're one of them, you should get in touch to see, because we do give some additional points for this, depending on the level that you're competing. But again, being a competitive athlete, it can definitely bring a lot in your personal statement, because it has to do with competition and, how do you endure this lifestyle, because you don't have to just compete, you also have to keep up with your grades. So again, yeah, wouldn't be any problem at all.
Yeah, I mean, I think if you're a competitive athlete, you will go through the same experiences of communication, teamwork, conflict resolution. So it's just a different way of getting those skills. So we're just using volunteering because that's a question of sport, no skills.
Anything big to add, or should we?
Yeah, I think competitive sport's a great thing, actually. I think it teaches you discipline, and I think it teaches you that putting in the effort produces reward as well. So I echo that these thoughts that they're exactly the same things that we're looking for you to get from volunteering or work experience elsewhere. So absolutely, it's a very positive thing.
We'll maybe do some quick fire questions. We're getting near the end. So we've got one for Queen's. What would happen if my school did not offer the advanced hires that you specify?
So the two advanced hires we asked, one was chemistry, and then the other was one other science, and if it wasn't that, biology. And that's mimicking what we're asking at A level as well. So if there's anything with a specific subject question like that, the email I put up, put exactly what you're doing and put it in an email to us. And that's what we're there to try and answer, personalise the answer.
And we heard a lot about widening access programmes, and someone has asked, how do you identify yourself as a young carer? Are there any additional requirements besides just saying that you are one?
I can answer this because we've had lots of meetings about this in the past. You have to be registered with your local authority. So just saying that you're a carer isn't a carer. So if you contact all the universities have reach teams, widening access teams, but for Glasgow they will specifically want you to be registered with the local authority. Because otherwise lots of people become carers in the 6th year.
Any differences otherwise? No. Okay.
Yeah. So if you have caring responsibilities, you have to let us know in your personal statement, and also let your referee note that in his reference, and we might get back to you to ask the extent of your caring responsibilities, and depending on the evidence that you're going to give us during the application process, then we will see if you would be under any consideration, either as a flag or a plus flag.
And then, is there any difference in terms of getting into medical school between a home student applicant and an international applicant? If you start at this end.
Yes, so the ratios are different, obviously. All of us sat here, we are given targets each year by the Scottish Funding Council, so we don't actually get to choose particularly what the proportions are, and they're released relatively late throughout the cycle. Typically, I think we're probably looking about 8% across Scotland, I think, for overseas applicants, and the remainder for the courses would be home Scots or the remainder of the UK. I think that's about right.
Yeah, international students are totally separate. They don't take any of the places for government-funded posts, and if they did, we would be in a lot of trouble.
And you can just do your research and just check for the medical schools that you wish to apply, to see how many places are available. So, for example, for Edinburgh, in the past 2 years, we had 166 places for Scottish Sphere 8 applicants, and on top of this, we had 25 places for SIMD 20 and care experienced. And then our UK ROI was 79 and our overseas 21.
Any other questions from our audience? Okay, probably got time for a couple more, or one more. Right. So we've got, with a low UCAT score, is it advisable to apply for a gateway to medicine programme or for a medicine programme with adjusted or minimum entry requirements? Start at this end this time.
So we do not offer a gateway to medicine program in Edinburgh, and as I said, it depends on the type of applicant you are. You're flagged as, like for example, if you're a plus flag, you only get to meet our minimum entry requirements, and you do not need to meet our cutoff score because you get further concessions. But for flag and any other applicants, you have to meet our standard entry requirements, and depending on the fee rate, it could be risky applying with just on the cutoff score, because we get so many applications and it can be very, very competitive. So please email us with your full profile, and maybe we can advise you to get in touch with our widening access team if you were to be eligible for any consideration.
I'm not entirely sure I understand the question. Essentially, widening access is very clearly stipulated Q1, Q2 postcodes. Your UCAT score hasn't got anything to do with your application status. Your UCAT score is part of a process of then further stratifying your application. So if you don't come from widening access group, then you don't get any adjustment to your UCAT score, if that makes sense. So So you have to be part of the group. You have to be part of a widening access group first. And if your UCAT score is lower, you will get an uplift, but not the other way around. Just because you've got a bad UCAT score doesn't put you into a widening access group.
Our widening access is slightly different. So it's just for Northern Ireland. You probably realise we still have the equivalent of quoting 11 plus, or at least a test, a selection at age 11. So for any child who, any pupil who did their GCSEs at a non-selective school in Northern Ireland, they have to do their UCAT, but they go straight through to interview. But they do need to get the full offer at A levels, okay? Because many of those schools wouldn't be able to offer maybe 6 or 7 or 8 GCSEs, and they therefore couldn't compete at interview. Separate to that, we have a widening pathway, and it's exactly the same as the others. You're on the pathway programme because you're a pathway student, and it's not because you didn't do so well at UCAT.
I think it's probably about phrasing the question in the right way, actually. I think you shouldn't choose which course to go for based on what your UCAT score. And again, I would reiterate that you only have that choice if you do fit with the widening access criteria in the first place. But I think it's important to think about your own circumstances and what suits you best to determine which course you apply for. Have a look at all the different university courses, look at the different gateway courses, see which one would suit you best, have a think about your own circumstances. Some people who've had difficulty in the run-up to applying to medical school, a lot of those difficulties will go away, but for some it doesn't. And for some that transition is a lot harder, and I think in those circumstances the gateway course is definitely the right thing. So I don't think I wouldn't make the decision based on your grades and your UCAT. I would make the decisions based on what's the right path for you at that time in your life.
Great. Well, I think that brings us to the end, and I'm sure my colleagues here agree that we wish you all the best in your decision making, your applications, and if you'd like to join me in thanking our speakers today, thank you.